My area of specialty or my area of expertise is in neurological surgery. I focus on the whole system, including both cranial, peripheral nerve, and the spine, but my main focus is the spine. For my practice in the spine, I do a wide range of procedures. Minimally invasive spine has always been a favorite of mine. I think just due to the advanced technology techniques as well as being a shorter duration of surgery for patients with less blood loss and quicker recovery times. I also taken the role of doing palliative pain and chronic pain, which has always been an interesting field for me. I think my background as a dialysis nurse, where we dealt with the chronicity of kidney disease, I transfer over to the chronicity of pain. There's some disorders of the body where there's no solution for their pain, and their pain has been not treated through other traditional methods. What we offer and what I have to offer is other methods that don't involve any type of direct spine surgery per se, but finding other ways to treat and alleviating pain in patients, whether it's in their back, their legs, or even their neck or arms. I think one thing I get from my patients over and over, because a large part of my practice now has been referred from previous patients. I think one thing I have to offer is that I do take time with my patients. I don't know if it's from my nursing background or from exactly what stems from this, but I spend a lot of time with my patients before surgery, after surgery. Communication is key. So when a patient first comes to me, I want the first visit to be very open. You know, we take time in getting history about their personal and social history, finding out about their job occupation or things they do with their families or other habits. Patients ask me questions about myself, and I'm very open about who I am as a person. And through this interaction, we just form a relationship from the very beginning. I usually book for a new patient anywhere from 45 minutes to an hour, and I expect to utilize that time into speaking with them. There's of course going to be time used for their diagnosis and discussion, but I spend a good amount of time just developing that initial relationship so it can be a good trust and understanding throughout the process of their illness. I get a wide variety of kyphoplasty cases, and it's interesting because I do get the complex ones. I receive ones that are turned away from other radiologists or other surgeons, and these usually involve some type of fracture that's just not localized in one area. It's going to be a fracture that involves multiple parts of the vertebral body, which is the main part of the bone, and a lot of times it involves part of the bone pushing back towards the spinal cord or nerve. The reason it's sent to me is because I can deal with any kind of complications that may arise from it, but it also allows me to consider them for other procedures that may help alleviate this problem. Sometimes kyphoplasty alone can cause new problems if you don't recognize the pitfalls ahead of time. And I get the complex cases where there's bone that's somehow maybe pushing on the spinal cord, where there's some possibility that the procedure can actually even injure or paralyze the patient. And when I see this ahead of time, I can actually do sometimes a minimally invasive procedure in conjunction with the kyphoplasty. And I've done this plenty of times where I've gone into a very small incision, less than an inch, help remove some of that bone that's in the way, or help make room for the spinal cord, and then proceed with the kyphoplasty. So all in all, maybe add another 45 minutes to the surgery, but allows them still to leave the same day, have excellent results, and then at the same time protect them from any type of catastrophic complications that can occur if you just did a kyphoplasty alone. If it's a procedure like a kyphoplasty, they tend to go home same day, and the recovery time is essentially immediate. If it's something where we do a minimally invasive spine, the recovery time for surgery like that, I ask patients to minimize strenuous activity for 4 weeks. But after that 4 weeks, they can pretty much be free of all restrictions and return back to normal activity. Something that's more complex, where I do a spine fusion or I do some type of spinal reconstruction, it varies, but those go anywhere from 6 to 12 weeks. And I try to brace people for short periods of time. I see patients who've been operated on or braced for 3 to 6 months, but I explain to my patients that long-term bracing tends to cause a lot of weakening in the muscles and causes issues later in life. So I try to balance the bracing with trying to rehab them quicker and get them back on their feet. It's all about being in motion, because their motion is going to lead to the recovery. The people in my group are all phenomenal. We all help each other out. We play as a team. There's complete trust among one of us. We all have different fields of expertise, so we rely on each other for advice. Because quite often my partners will ask me to look at films and ask me what they think, and I'll do the same with them. And it's just a continuation of going back and forth with each other, which has helped us to grow. stay as a strong focus group. But at the same time, I feel I have a great responsibility to my patients to deliver the best care, to be completely honest with them, and to strive for the best results, because the only success I'm ever going to receive, or any type of satisfaction I will ever receive from my job, is based on my patients' outcomes.